presentation is at that it's going to be perfect for some of the students listening.
There you go. The
Yeah.
pressure is off. It always is
Yeah.
good for someone.
Yeah. So I think you can proceed. I've started the recording. We have 11 people here, so, and there will be more.
Sounds great. So hello, everyone. I think I can see Nadia and probably everyone else's camera is turned off, which is completely fine. I spent the night sleeping on the floor of the bathroom because we just got a new dog and I can't stand for her to whimper. So my apologies. I'm a combination of post-call and post-new dog. That's why I'm
cool. Cool in itself. Yeah.
Oh, it's wonderful.
Yeah.
So my name is Michael Van Manen. I'm in the Department of Pediatrics, the Division of Neonatal Perinatal Medicine. So my clinical practice is as a neonatologist. That means the kind of patients that I take care of are predominantly babies who are born premature. So that goes right down to around 500 grams, 22, 23 weeks gestation. Babies who are born with different kinds of congenital anomalies. And then babies who have some kind of difficulties around the time of birth, like birth asphyxia or breathing problems. In addition to my clinical practice, I'm the director of the John Doster Health Ethics Center, and I have a longstanding interest in health ethics as well as qualitative research and media ecology. So thank you, Kim, for letting me join in your class today. I'm going to present today as well as on Thursday. For today's session, I'm going to focus mainly on health ethics. And then the session on Thursday, depending on how far we get, we're going to talk more about ethics and technology. But I recognize that everyone comes from a different background with regards to how they understand ethics. So I do think we need to kind of start a conversation together and make sure that we also have that same kind of understanding that we work forward from. I'm a really casual guy, so I really appreciate people interrupting me. So just because I'm using PowerPoint, please don't feel like we have to stick to the slides or this stream. And I'll send you, Kim, a copy of these slides after the presentation if you want to share them with students. So please feel free. Here's the link for the Doster Health Ethics Center. We do have health ethics seminars almost weekly that everyone here is more than welcome to attend. Those are generally on Thursdays from noon till 1. We also have a couple of health ethics workshops coming up in the next month. One on artificial intelligence, technology and ethics, which is free. That's not this coming Saturday, but the following. So please feel free to sign up for that. And then we have a full day workshop on health ethics the month after. And again, you're more than welcome to attend. We love having students in addition to seasoned practitioners. So I just wanted to start off by asking some questions. I recognize that most of you aren't in clinical practice as a nurse or a physician. But like I said, my area is health ethics, and this is about ethics and medicine and future thinking. So how do you understand the meaning of ethics? If you're a member of a health profession, or one day you hope to be a member of a health profession, what do you think that means? What does it mean to be an ethical nurse or to be an ethical physician? Are they the same thing? Are there ethics that are unique to nursing compared to medicine or social work or some other discipline? Are there moral conflicts that you experience in your personal life or professional life? What qualities exemplify an ethical individual, whether that's a healthcare provider or not? And really, what is the role of ethics in clinical practice, or we can say more broadly, in our day-to-day lives? These are going to be the take-home points for today. And I'm going to work through each of them and we'll come back to them. So the first one is that ethics is always already present in our day-to-day interactions. In other words, Ethics isn't just about those situations where we don't know what to do or we're questioning what's good or bad. So what I want to do is start off by sharing some images with you. And I want to ask you, what do you see? And I can see everyone's name, so I can easily ask people as well, but it's much more fun if people volunteer themselves. So what do you see when you look at this image?
I'll just go out and state the obvious. I see a baby
Yeah.
being held by a person, and it seems like helped or by another person.
Okay. Thanks, Nadia. It's always hardest to be the one to unmute first. I really appreciate it. I'm sure Kim will give you extra points at the end of the semester. Yeah, this is a picture of a baby. It's a picture of a baby who I took care of now probably about 3 years ago. A little girl who was born with congenital heart disease. She was about a month, 6 weeks old in this picture. You can still see the scar in her chest from the sternotomy. And she's being held by her parents in the NICU. Her dad's cradling her close to his chest. And then her mom is reaching in, preventing that little feeding tube or NG tube from being dislodged. And yeah, we can talk about it by saying, what do you see? Well, I see, a white baby who has blackish brown auburn hair, right? I see the feeding tube. I see the monitor lines, the monitor probes. But the more interesting question is, does this picture or does this image have an effect on you as someone who sees it? Meaning, are you simply seeing a baby? Or is there something else in that image that maybe is harder to put to language? Thoughts, either from Nadia or anyone else?
I feel like the baby is in pain. It's probably an exaggeration because I was not the doctor that took care of it, but I feel like with the tubes and the assistant that is in the baby's body, it looks like he would probably in pain.
Okay. Thanks. Is it Anne Bowie? Am I pronouncing your name right?
Yes, it's Anne.
Okay. Thanks, Anne. It's funny, I showed this image to my father at one point, and he's not in health at all. He has a background in education. And, he looked at it, oh my gosh, that baby must be suffering, right? Compared to if I showed it to a nurse who works in the NICU, she'd probably say, wow, that baby's so well, what's it doing in hospital still? So we can have a different perspective with regards to what we see, depending on our vantage point, right? But I appreciate, Anne, that you're saying that when you see an image of a child or you see an image from someone else, there can be almost a wondering to that look of, well, what is this baby experiencing in such a moment, right? Could she be in pain, right? Does she have a sense of the person holding me is my dad? What does that mean for a newborn to recognize someone? Does a newborn recognize their parent in the same way that you or I do, right? What does a baby experience in a moment of touch or contact? And then, of course, the ethical question is does this image in some way touch on us? What do you see in this image? Or what's conveyed here? What do you find yourself responding to? Nadia and Anne are off the hook because they've already volunteered, but I see a few other names. Oh.
I see like an older, almost like a grandmother figure. I think it speaks to me in a specific way because my grandparents are getting older, so it kind of elicits this pull at my heartstrings. and almost like a sadder kind of vibe. Almost the need to provide some kind of care. That's the kind of emotion that's elicited for me.
Thanks, Darian. Am I saying your name right as well?
Yeah, it's Darian.
From what I recall, I think this image is from the Alzheimer's Society, or ALAMI. But yeah, it's of an individual with dementia who's experiencing a moment of touch. You know, I gotta say, when I see this picture, I think of my own grandfather who had quite advanced Alzheimer's before he passed away. And, you know, there were moments when we would go and visit him. He wasn't verbal anymore. He didn't have speech. But you'd hold his hand and he'd just clutch it back ever so hard. And there was a sense of recognition there. But other times it felt like we were seeing a stranger, right? But again, there's something in this image that's conveyed on us, maybe something that makes us wonder, that makes us concerned, that is more than the fact that this woman has gray and white hair, more than the fact that she has, you know, frail skin, or that she's more aged than you or I or most people in attendance. How about this image? This is taken from just this past summer, down on the outskirts of downtown, right? Does this image have an effect on you? What do you see here?
For me, it seems to speak of just the individuals in society that are either left behind or haven't found a place or aren't able to.
Thanks, Tian. Am I pronouncing your name
Yes.
right? Oh, yeah. Yeah, you know, as someone who didn't have that life, right? I'm going to be honest. I grew up very privileged. I mean, my parents were teachers, right? Never had to worry about, you know, home, shelter, food on the table. You know, clearly other people grow up in different circumstances and live their lives in different circumstances. And there can be a tendency to look at those circumstances in a sense of despair, right? Particularly when you imagine what might living in such a home be like, right? How does someone experience home? How about this image? Nadia, I should have taken a picture right when your mouth, the corners of it changed as you saw the picture.
I mean, it's something about the look in that poor monkey's eyes that just like pulls at your heartstrings, and you just, I mean, I don't know the context, like the framing of the picture, like maybe this monkey's on the outside and I'm in the cell, but like it's I guess it's that like automatic like sense of like empathy and like, oh, this is a being that's like hurt and I need help.
Yeah, I mean, I don't actually know the context of this image, right? Maybe this little monkey is being saved and, you know, brought to be set free. Maybe it's subject to animal research. I don't know, right? But yeah, there's something about this image, right, where, you know, you find yourself looking at it and it somehow has that effect on you. How about this image? This is from, you know, our home energy province of Alberta, right? In the oil sands, right? Does this image have an effect on you? And clearly our economy is dependent on, or was dependent on our energy resources, right? You know, many people's, you know, education has been afforded because of the resources of Alberta. But on the other hand, our lands have also been scarred, right? Because of exploiting the resources as well. The reason I'm showing all these images is I want to try and convey to you that this is actually what ethics is fundamentally about. Let's just skip that one. Ethics is fundamentally concerned with issues of otherness, with issues of responding, of coming to terms with a subjective experience that might not be our own, right? And it's a discipline that can't be resolved by simple argument. What do I mean by that? There's something about ethics that when we try and, put it to task, when, we come up with a framework for ethical decision making, a framework for resource allocation, you name it, there's always something that escapes rationalization, something that we have to cope with. So for me, what kind of is the essential feature of ethics is that it's found in the concern for whom or what is other to ourselves. And knowing that we don't live isolated existences, we're continually confronted with ethical situations in our day-to-day lives. Whether that's in approaching a patient who might be in pain, maybe a baby, and a baby will never have the language to tell us whether he or she is experiencing pain, or whether it's withdrawal, or whether it's something else. Whether we're dealing with, an elderly loved one who is so-called declining, right, as they age. Whether it's in dealing with our neighbor or our children, right? This is what ethics is about. It's not an individualistic pursuit. It's about coming to terms with how we respond to someone who's other than ourselves. There's a French philosopher. I'm not sure if there's any philosophy majors here, and if there are, I'm going to butcher this, so my apologies. Emmanuel Levinas is a French phenomenologist. He's passed away. His kind of first important text, or one of his most important texts, is Totality and Infinity, which is essentially a phenomenological description of ethics. And how he describes ethics is an optics. So by optics, it's a way of looking at the world, all right? It's a vision without image, bereft of the synoptic and totalizing, objectifying virtues of vision, right? So, when we experience, in looking at that monkey and having that sense of, is he okay or is she okay? What should I do? What's my responsibility here? It's a way of looking at the world where the physical features themselves aren't important, right? I don't think anyone here would remember, was that a black monkey or a white monkey or a gray monkey? It's not those objectifying virtues of vision. It's a relation of an intentionality of a wholly different type. An intentionality is a technical term that relates to consciousness, right? So our directedness. So when we're conscious, we're always conscious of something. But ethics also involves notions of right and wrong. And this is from Wittgenstein's Lecture on Ethics. And he describes ethics as the inquiry into what is valuable or into what is really important, the inquiry into the meaning of life or into what makes life worth living, or into the right way of living. So an ethical topic would be something like compassion, right? A topic for ethics would be trust. A topic for ethics would be suffering. All of these kind of meaning aspects of our life, which aren't simply emotionality, but they rather describe, well, this is why we're here, right? We're not here just to perform some task, but hopefully to live a meaningful life. Any questions so far about this? No? So my first point was that ethics is always already present in our day-to-day interactions, because we live in a world with others, and the decisions we make, the actions we take, in some way always implicate someone who's other than ourselves. even when we're alone, we are experiencing the world in the absence of another, if that makes sense. Now, the prototypical ethical question isn't what is the ethical issue? What do I mean by the proto-ethical question? I mean here like the first ethical question. Rather, it's what is going on to which I must now respond, right? And I try and teach our residents and other medical student learners this when we're talking about ethics, that the best way to confront or to approach a situation that somehow demands ethical reflection is not to begin by asking what's the problem here, or it's not to ask what's the solution, but rather asking what's going on, what are different perspectives that could be unfolding here. Okay, I'm going to see if I can do this YouTube video, okay? Can you see the video okay? No? All right, one second.
Imagine.
We can hear it.
One day, with the
All
feeling
right,
that something
I'm on
isn't
it.
right.
1 second. Sorry, I'd love to say I'm smoother at this, but I'm just not. All right. So what I wanted to start off by sharing with you is a thought experiment. Now, these are very common in what I like to refer to as quandary ethics. And they're one way of approaching ethics. And this is this famous thought experiment related to the seriously ill violinist. Okay, so I didn't make this, I'm using it from YouTube. So please don't, all the credits are towards them. Can you see the screen now?
Yes.
And see it in full?
Yep.
Yeah, all right.
Just imagine. You wake up one day with the feeling that something isn't right. Where on earth am I? Is this man next to me? And why are there tubes connecting me to him? A doctor explains your situation. The man next to you is world famous. He is a virtuoso violinist. But his life is in danger. He suffers from a fatal kidney disease. He's been waiting for blood for days, and time is running out. But then, yesterday evening, a few of his biggest fans brought you to the hospital because you are the only person who has the exact same blood type as he does. Connecting your two circulatory systems is his last chance. Otherwise, he will die. You, and only you, can save his life. What? All of a sudden, you remember, last night the violinist's fans kidnapped you and brought you to the hospital. The doctor can hardly believe it. They kidnapped you to save the violinist. You try to free yourself from the tubes. Get me out of here. But the doctor tries to explain to you. As soon as you pull out the tubes, the violinist will die. You will kill him. You can't do that. She tries to calm you down by assuring you that the therapy doesn't last forever, just 9 months. Then, the violinist will be restored to perfect health, and you can go home. So what do? Do you pull out the tubes? Or do you stick it out in bed for 9 months? What's more important? The violinist's right to life, or your right to self-determination? Some philosophers see a similar dilemma with the termination of unwanted pregnancies. Pregnancies because contraception failed, for example, or even as a result of rape. The life of the unborn child depends on the pregnant woman, like the violinist's life depends on you. And assuming the unborn child already has a right to life, the question is, which right is more important? The fetus's right to life or the pregnant woman's right to self-determination?
So that's quite a famous, you could say, thought experiment from, sorry, I just have to now reshare my screen. A famous thought experiment employed in philosophical debate about the ethics of abortion. And it's a kind of typical thought experiment where it starts off with just a very hypothetical situation, right? To kind of break from that natural way of looking about or thinking about an issue, right? Like abortion. So we're no longer thinking about a fetus. We're no longer thinking about an expectant mother. We're no longer thinking about the conditions that led to pregnancy. We're actually making the situation, frankly, a little bit ridiculous, right? That somehow you've been abducted in the middle of the night and hooked up to a dying violinist, right? And essentially you need to stay connected to him for him to survive. So surely, to save this other individual's life, the ethical response would be to endure those 9 months. And then by extension, how could we reasonably, ethically support someone to choose an abortion, right? My attempt in presenting this video isn't to advocate for or against abortion at all, but rather to kind of show by example one particular way of thinking about ethics. And what's inherently quite problematic about such cases or thought experiments is perspective is disregarded, you could say, or that the ethics themselves are disregarded. Because being hooked up by an intravenous is quite different from being pregnant with a baby from your own body, right? It's very different than when you may or may not know whoever is the biological father, right? So it's a way of looking at ethics that's unfortunately quite distant from perspective, which is problematic. Another classic example is the trolley experiment, and some of you may have heard of this before. And essentially the idea is there's a trolley going down a hill or going down a track, and it's out of control, right? And you are standing at a junction point. If you do nothing, the trolley will continue on its current course of direction and roll over 5 people, right? Or you can act by hitting a switch, in which case the trolley will be redirected and only 1 person will die instead of 5. What is the ethical thing to do? Does that make sense? And there's different variations of this where you're standing over a bridge and there's a so-called a fat man, that's the name of this one, where you push the fat man off the bridge and you can prevent the trolley from hitting these 5 people. And there's countless other ways, like what if one of those people was a child? What if it was a school? What if they were criminals who were laying down compared to someone who hadn't committed crimes? There's so many of these thought experiments that have been written about in the ethical literature. But when it comes to health ethics, and ethics in clinical practice, these are often interesting cases to generate some debate or discussion, but they're so far removed from the actualities of ethics as we actually encounter them, right? So, this is a picture from, during the COVID pandemic in a hospitalized setting, right? If we're talking about the ethics of visitation policies, right? And separating people from their loved ones as they're passing away, there's an ethics to that can't simply be drawn or decided about by analogy to some hypothetical situation, right, of a trolley, right? The trolley experiment is a way of informing something called utilitarian ethics, where, you know, you want to maximize good and minimize harm. Clearly, the ethical thing to do is to flick the switch and avoid loss of more lives compared to a single life, right? And that's the same kind of ethics that have been appealed to for the COVID pandemic, right? Is a utilitarian approach where we're trying to maximize good. We're trying to deploy the vaccine to the people who are most vulnerable. But there's an ethics that actually unfolds in relationships. Well, how do you talk to people when they can't come and see their loved one? How do you deal with that situation? How does decision-making unfold? And that's where one always has to try and gain some sense of perspectives. And that's really the nature of ethics. So when I say the prototypical question is, what is going on to which I must now respond? Well, what's going on for the patient in this particular moment? What's going on for the health professional in this particular moment? What's going on for the family member? These are all different perspectives that need to be looked at, that are lost if you look at ethics abstractly. Does that make sense? Okay. All right, the next take-home point. Moral consciousness, or you could say moral experience, expresses intersubjectivity, historicity, temporality, purpose, meaning, and freedom as constitutive elements. I'm sorry, this part is going to be a little bit technical, but I do think it's important because everything here is going to build the foundation for talking about technology and future for the next class. So what is the notion of moral experience? And I really like this definition from Franco Carnevale. He's a health ethics researcher from Eastern Canada. So he describes moral experience is subjective. What do I mean by subjective? I don't mean the opposite of objective. Rather, I mean there's a perspective to it, right? So Nadia has a particular subjective experience. Tian has a subjective experience. Anne has a subjective experience, right? That is informed by their own capacities and ways of looking at the world. And it's hermeneutic. What does hermeneutic mean? There are interpretive dimensions to it. It involves sense making, right? So moral experience encompasses a person's sense that values that he or she deems important are being realized or thwarted in everyday life, right? So what's an example of a moral experience? If, you know, I value sharing as being very important, right? And I see, you know, two people afforded very different opportunities and no sharing of resources occurring between them, that to me would seem unjust, right? So let's go through these different technical terms I showed you on the previous slide. Moral consciousness is structured by an intersubjective intentionality. What does this mean? This means that our moral consciousness is informed from living with others, right? So experiences of shame, for example, experiences of guilt, experiences of jealousy are in part present because we don't exist in the world alone, right? I may experience shame when I feel someone is seeing something that I'm performing, which is deplorable or not appropriate, right? I might experience jealousy when I feel that someone else is getting something that I should have received, right? So there's intersubjectivity to it. So morality presupposes the acknowledgement of and response to other selves who share our world. The moral self is a historical self, right? What does this mean? Each of us were brought up in a particular family that has particular values, and that family is embedded within a particular culture. It has its own history to it. We don't exist in this moment of the now without a history from which we came. And the history that we've lived through and that's been taught or shared with us from those people that we've learned from shapes our sense of what is right and what's wrong. So to exist historically means to be in a process of arriving from a past and moving into a future. So that's a really nice way of thinking about moral experience. We're constantly arriving from a past and we're moving towards some future place. Which means when we start talking about futurism and ethics, we have to ask, what past are we coming from and what future are we moving towards, right? Moral experiences have a retentional character tied to past experience and protentionally qualified by that yet to be experienced. Oh gosh, this is a bunch of hustle. I'm sorry for that. What does this mean? That in that moment of experiencing anything concretely, there's always this sense of something that has just happened and something that it is anticipating. A nice way of illustrating this kind of character of experience is thinking about a melody, right? If you listen to a melody, you know, twinkle, twinkle, little star, right? It only makes sense, each note of the melody makes sense because of where it came from, so the retentional character of that note and what it's anticipating, right? So you expect to hear how I wonder what you are. Does that make sense? So all valuations in the concrete life world, which is another way of saying the world as we live it in our day-to-day life, occur within a temporal context, rooting in a living present that contains within it a past, a living past, and a living future. Okay. To exist morally is to envision a purpose. So purpose as a compelling element in this living future conditions the action for the present and determines the significance of the past, right? So we have a sense of what are we trying to achieve, right? To have an experience like jealousy, well, there must be something I'm hoping to obtain for which I am jealous that I didn't get something afforded to me, right? So there's something I'm moving towards. The moral self envisions the achievement of a meaningful life or a meaningful mode of existence. So we don't experience the world in a sense of confusion where we're just overwhelmed with sensations, but we can use terms like compassion. We can use terms like passion or empathy, right? Or forgiveness, because we recognize that there is shared meaning in our life, right? So meaning as a moral category structuring moral experience indicates a condition of self-unification or self-integration. What does that mean? That we don't experience meaning separate from the way in which we make sense of it, right? But at the same time, we do live in an intersubjective world where, you know, even though Nadia and I, or Kim and I, or Tian and I have very different backgrounds, I'm assuming, we can still have a conversation with regards to the shared meaning of what is jealousy. And finally, the freedom of the moral self is a finite freedom, limited by finite existential time and existential space in which moral actualization occurs. We don't experience the world in our day-to-day life as one without limits. The limits of our present is that it's qualified by our past, and the limits of the future is what comes with time, right? So I'm hoping that those different statements aren't too philosophical, but I'm trying to give you a sense of when we talk about a moral experience, we need to realize that these different conditions are present in our sense making. So if we're going to try and imagine, you know, what constitutes a moral life in the future where we can experience consciousness apart from our body, we would have to ask such questions as, how do I experience others in such a consciousness? How do I experience past in such a consciousness? My sense of future? What would meaning be like, right? If I saw someone suffering over, YouTube, is that the same thing as witnessing suffering unfold in front of me, right? Outside of some kind of, social technology, right? Questions up to this point? Okay. So the next point is varying moral perspectives locate morality differently, serving as heuristics to evaluate actions. All right. So this is part of the vocabulary of health ethics. And for me as a clinician who also is engaged in the ethics works, it's very important to recognize these different perspectives or these ways of thinking to help navigate difficult situations, particularly situations where people might disagree on the right course of action. So the first kind of way of looking at health ethics or locating what is right or wrong is what's called deontological perspective of ethics. This is sometimes described as obligation, duty, or rule-based ethics. And an action is essentially viewed as right or wrong based on whether it conforms to the rule or principle or other obligation that binds it. Does that make sense? So the classic example of this would be, say, the 10 Commandments, right? A commandment reads, "Thou shalt not kill." I am doing good in the world if I do not kill, because my action is abiding by that rule. Does that make sense? That's where the goodness of something is located. Now, what's challenging is, why is "thou shalt not kill" the rule to follow, right? Why should I follow that rule compared to the rule of thou shalt act in a way that benefits thy family or that benefits those individuals who are closest to me, right? Now, one response to this is this, what's known as the categorical imperative by Kant, which is act only according to the maxim, whereby you can at the same time will that it should become universal law. What does that mean? You should only act in a way whereby you would expect others to act in the same way, right? Meaning, thou should not kill because I want other people to also follow that rule. Does that make sense? Okay. Now, as that kind of underlying principle, one can still ask the question of, why do I follow that maximum compared to one other? And this is unfortunately the challenge with all of these different theories of ethics, is ultimately at their ground, right, is some kind of an assumption that this is the theory, this is the principle to follow. Usually how these principles are defined is based upon our history, right? They're based upon learning from mistakes or agreed upon standards. So for health ethics, the most common kind of duties that are recognized for action are beneficence, meaning that physicians and other healthcare providers should engage in actions that do good, right? So I should give a patient morphine if they're in pain because that is doing good. It's relieving their suffering. That's the good I'm hoping to achieve. I should engage in actions that avoid harm or non-maleficence, right? So, I should not subject a patient to a painful procedure, right? Unless it has some kind of a benefit towards that patient. Or respect for autonomy. I should respect the independence of the patient. I shouldn't treat them as a means, but rather support them to make decisions that they feel are right for them. And then the final one is justice, which is essentially I should be equitable not just for the patient or group of patients, but also for society at large. It would be unfair if one patient got all of the resources at the expense of all other parents. There needs to be some kind of distributive justice. Does that make sense? But so when we're talking about deontology, we're asking what rules ought to be conformed to, which is very different from a consequentialist perspective. A consequentialist perspective takes the consequences of an act as the ultimate basis for moral judgment about the rightness or wrongness of that conduct. So the famous articulation of a consequentialist perspective end is trying to be achieved, whether it's something like aiming for the maximum well-being or maximum utility or maximum happiness, right? And there are also examples where a principle can become the statement of the ultimate aim aiming to be achieved. So when I was talking to you about principalism and health ethics, beneficence and non-maleficence are actually another way of talking about utilitarianism. Does that make sense? So the morality, the goodness or wrongness of an action here is situated in the end rather than the principle, which is very different from a character-based perspective. So an example of a character-based or a person-based approach to ethics would be virtue ethics. And here the attention is shifted away from the principle or the outcome to the qualities of that individual, right? So in wondering what I should do in a particular situation, I might ask, what would a good doctor do in that situation or a good nurse do in that situation? What does it mean to be compassionate, right? As far as to realize compassion, how is that displayed as a virtue, right? Often in situations where we turn to virtue ethics, you'll see people turn towards, well, you know what, Dr. So-and-so is a very experienced clinician. Let's ask for his advice, right? Because he always seems to be reasonable in his decision making, and being reasonable is a virtue, right? But here again, the struggle that we ultimately have is which virtues ought we to aspire to? Are the virtues of a good physician different from the virtues of a good nurse? Are the virtues of a student different from the virtues of a teacher, right? Another example of a perspective to kind of moral theorizing are communitarian perspectives. Communitarian from communier, meaning to make common or to share. An example of a communitarian approach would be narrative ethics, right? Where ethics isn't realized in the virtues of a particular individual. It's not realized in the outcome of an action. It's not realized by whatever rules or principles might direct individuals to act a particular way. It's rather how everything holds together. If I can share with you openly about a patient's story in hospital, if I can talk about it in a way where I don't feel shame about it or despair as a clinician, there's something good about it. If I can tell it not in the way that it's a good entertaining story, but a way it's a story that can be shared, that encompasses its moral qualities. So this is a way of dislocating what is moral away from an individual to how things hold together. There's also relational ethics that displaces ethics to the relational commitments between individuals. And there's also ethics of care, which comes from feminism as well. And I'm speaking about all these things really briefly, but I'm trying to give you a sense of just how large the field of health ethics is. Then there is contractualist perspectives. So contractualism basically posits that we create morality. We create what is good and what is wrong by forming an agreement with each other, right? If, I agree with my children that if they clean up the yard when the snow melts, I'm going to buy them a Lego set. If I don't end up getting them a Lego set, despite them spending hours cleaning up all the dog poo and leaves from the backyard, I'm not acting in a good way because I'm not honoring our agreement. Contractualism is also present in medicine through the action of obtaining informed consent before a surgery. We talk to a patient or other decision maker regarding what we hope to do. We explain the risks, the benefits, and we form a contract with them. And our actions are judged whether we uphold our contract to perform care. So this again dislocates the question of what is good to what agreement exists and how did we fulfill our obligations to each other. Recognizing that many agreements that we have with one another are asymmetrical, right? So there are power differentials in clinician-patient relationships, for example. Another example of a different approach to morality is casiatry or pragmatic perspectives. Casiatry comes from the notion of a case, where a case is asking what has happened, what has befallen, right? You'll see casiatry and health ethics when we turn to similar or dissimilar clinical cases that we've encountered previously. To give an example, at the university hospital, we've taken care of a number of babies who have quite severe congenital malformations or syndromes, such as trisomy 18. And some of these babies have received, open heart surgery, despite this condition generally associated with various issues in the long term from a developmental perspective, as well as medical issues and a shortened lifespan. But if in the past we viewed particular actions associated with particular cases as right, then we can ask about current cases. How does the current situation compare to what has happened previously? We often see casiatry applied in the legal system, right? Where people look at case law, our previous case decisions that were made, and they compare individuals' actions to previous actions that were judged. Does that make sense? Okay. Any questions so far? I realize I kind of just talked nonstop for about half an hour there. No, okay. So how do we put all of this together? This question of ethics is all, not this question, this point of ethics always being present in our day-to-day lives. This notion of a proto-ethical question, what conscious experience is composed of, and these different moral ethical perspectives. How is this actually revealed or work in health ethics? I don't think I'll just send you this slide. We don't have to go through it again. So how we generally approach ethics in clinical practice is the first thing that we do is we recognize that we exist in these moral ethical situations as healthcare professionals. That as doctors or nurses, social workers, respiratory therapists, you name it, we are caring for people who are other than ourselves, right? We're taking care of babies. We're taking care of children. We're taking care of people in their middle ages and people who are elderly. And all of these individuals are part of communities as well and have different ethical responsibilities towards one another. So we have to, first of all, recognize that we are in situations of ethics, right? And the next thing that we need to do is we need to adopt a questioning attitude towards the situation. So we need to actually ask, when we come confronted with a situation of not knowing what to do, what's happening here? Whom's involved? Well, you know, I'm hearing from the surgeon that they don't want to perform surgery on this teeny baby because they're worried the baby's going to die in the operating room theater. Well, what might it be like as a surgeon to take a kid to the OR and have them pass away in front of them? What is their responsibility as a surgeon in that situation? What might it be like to be a parent and have a kid born at 23 weeks and have their kid hooked up to all kinds of machines and equipment and be confronted with decision making around limits of medical therapies and resuscitation, sometimes before you even had a chance to hold your baby or name your baby, right? When we start to ask that question, often we approach a situation more openly because we realize our own perspective of the situation is just one perspective among many, right? If we're having a hard time kind of adopting that questioning attitude to the situation, talking to colleagues or other healthcare professionals, what do you think about what's going on? Have you had experiences or situations where you've dealt with such situations, right? And again, the point here is constantly to open towards other perspectives. When we start to gain a sense of these other perspectives, to begin actually making some of these moral questions explicit if they need to actually be asked, right? So, you know, how early is too early to resuscitate babies? What does truly informed consent look like in a hospital setting, right? Is it appropriate for people to have to request medical assistance in dying or MAID in an advanced care directive that's currently going before the Senate in Canada for a vote in the next 24, 48 hours? What principles should we turn towards to allocate vaccines, knowing that we don't have enough supply to meet the wants of every citizens in Alberta, right? Clarify understandings of the language used in articulating such questions. If we keep on coming back to the notion of utility as a guiding principle for allocating vaccines, what does utility actually mean? Are we using it in the same way as each other? Does utility mean simply to maximize the most good for the most people? Or does utility mean to reduce the risks of the most severe outcomes to the minority, right? What does utility mean? What are we striving for? And it's often in clarifying the understandings and the language that we use, will often turn towards what can be described as codified ethics or societally recognized standards for practice. So what do I mean by that? It would not be unusual for Dr. Soles or myself to look at the Canadian Medical Association Code of Ethics for Physicians if we're struggling knowing what to do, because there are a number of principles, a number of virtues that we're supposed to follow as healthcare professionals. And if we're not sure what to do, that codification of ethics can be a valuable document for guidance, right? And then ultimately identifying reasonable courses for action in a particular situation. Often in healthcare, there's more than one possible decision or way of proceeding with a situation. The question of what should we do is revealed by the fact that physicians, nurses, and other healthcare professionals are not sole decision makers. We're interacting either with patients as decision makers or their loved ones as surrogate or substitute decision makers, right? So it's not unusual for me to sit down with a family of a very sick baby and talk about these are some different options of what we could do right now, right? One thing we could do is we could discontinue the different medical interventions that we're currently providing, recognizing your child might pass away. Another option is we could pursue this particular medical intervention because there's a possibility it might be of benefit, right? So, but what is the best course of action is going to depend on the particular history of that individual, right? So when I talked about the notion of moral experience, we don't make any of these decisions on our own. Does that make sense? So that's my crash course on ethics or health ethics 101, starting from ethics in that broad sense of presence in our day-to-day interactions. What I think is that good proto-ethical question to ask in situations, talking about what is this notion of a moral experience or moral consciousness, talking a bit about some theoretical approaches to ethics. And I gave the examples of deontology, utilitarianism, contractualism, humanitarianism, you name it. Recognize that each of them locate ethics differently, but they're all valuable heuristics, meaning ways of questioning a situation to look at it from a different way. And then ultimately kind of talking about some of the actions that we engage in when we start to deal with ethical situations. So for the next class on Thursday, we're going to talk more specifically about technology and some more contemporary issues for the future. But I want to leave time now for any kind of questions that people had about any of the content or things that I raised.
I suppose one question I had is, how do we sort of translate these ethical theories into our daily practice and sort of make a habit of like reflecting on the ethics of our action and stuff? Because I know, like, especially more like profession directed degrees, like usually you'll have like a course on ethics. I believe like engineering has one. I know for sure education has one. But like there's like certainly that gap between theory and actually like integrating it into practice in like a meaningful way.
Yeah. So that's a really good question to ask, Nadia. So there's the notion of reflective practice, essentially where as a practitioner, whether you're a designer, an engineer, or a healthcare professional, that your practice should involve in a daily way reflecting on your actions, both reflecting on your practice after the fact and hopefully also reflecting on your practice in that moment of practicing. And part of what is incumbent on being an ethical engineer or an ethical designer or an ethical healthcare practitioner is cultivating that kind of reflection into your daily routines, right? Design is an absolutely fantastic example for an area where there is a huge amount of power afforded to often a fairly select group of individuals that has huge societal impacts. But there actually isn't as far as I'm aware, a well-developed codification of the ethics of being a designer, right? But rather often design is driven, you could say, by consumer ethics in the sense of producing a product and selling what you say you're going to sell. But, we're the inventors of the iPhone, thinking about the ethics of how am I going to change social interactions between adolescents when everyone now has an iPhone who's older than 10 years of age, right? How does that change the way that life unfolds and people relate to one another, right? And the problem with design, of course, is when you design something and you put it into practice, it often affects the system in a way that you didn't even anticipate. So I'm sitting in my man cave room surrounded by old musical instruments right now. A clavinet that was designed for people to play classical Baroque music at home. But instead it was developed for, crazy funk music, right? Stevie Wonder kind of stuff, right? Like people often employ things that are designed in a way that the designer didn't intend. So who has ethical responsibility there? So I think I went on a tangent, but to come back to your question, the point is that it is your responsibility as whatever kind of professional you choose to be. And I use the term professional in a broad sense, right? Whether you decide to be a designer, whether you decide to be a writer, whether you decide to be a doctor, right? To reflect on your practice and ask those questions of how is what I'm doing affecting the lives of others?
There are quite a few of these questions that are kind of moral situations hard to resolve that persist for weeks, months, years. What is the role of the individuals facing them being able to take a break, to think about other things, to engage in humor and stuff like that outside that situation?
Yeah.
Often we talk about them as if they're just deadly serious and completely overwhelming. But yet that doesn't work very well if everybody is completely overwhelmed. Their lives have to be whole somehow in order for them to do the best job for this moral situation and this patient. Any thoughts about that? The other?
So, I think if, those ethical, you could say aporias that kind of persist, and it seems like, we talk around it forever and ever and ever, and we never will come to a complete agreement, is the nature of true ethical dilemmas, right?
Yeah.
A true ethical dilemma is not going to be resolvable, right? We're not going to reason our way through, should pregnancy determination be allowed, and if so, until what gestation, right? The reason that it's currently allowed to, in my practice, we actually extend it because we deal often with fatal or terminal conditions, is by and large historical, right? It was traditionally the time of termination was allowed until the quickening, meaning when you start to feel the baby as present as another to yourself. But, it's also kind of arbitrary to say you can terminate a pregnancy only up until that point when you can start to feel the baby as being there. Why that point compared to an earlier point, compared to a later point, right? And ultimately, as a society, we often have to come up with some kind of a rule to, you know what, keep things practical, to keep life moving. But we'll never quite resolve that issue, and there'll always be different perspectives about it. The question is, how does one live in a world where we're surrounded by ethics without being exhausted by it? The answer that I would provide to that would be, we have to choose the vocation that ultimately is conducive to our own, moral sense of what is right and what's wrong and what we can cope with on a daily basis. I have many friends in medicine who I respect and I value greatly, and I know they feel the same of me, but they would never work in neonatology because they would just find it absolutely gut-wrenching to be dealing with sick babies, right? For them, it's the most unnatural thing in the world for a baby to pass away, right? I feel the same way about other areas of medicine, right? Like, I feel a great deal of emotional distress when I see elderly individuals hospitalized with no family members coming to visit them, right? Compared to generally in an NICU, there are no such things as visiting hours pre-COVID for parents. They're there all the time, right? How wonderful it is to care for a patient who is cared about so deeply by people who are nearest and closest to them. So, my response, Kim, would be, I absolutely, I chose neonatology because I don't get overwhelmed by the moral ethical dilemmas, but rather, to me, it becomes stimulating, interesting, and a career full of meaning. And I'm sure, as a pathologist, you have similar sentiments for your own profession, and an obstetrician would say things differently, and a designer would say things differently, and an engineer. So I wish I could be young again and look at all the different options available, right? Does that kind of address your question?
Yes,
Or
yes.
is there anything you'd add to that as a experienced clinician?
I don't know. I should confess, though, that the trolley problem, I've actually done a video on that I'll share with the class. The simplicity of it obviously bothered me at the time. And during the height of Pokemon Go fever in Edmonton, one Tuesday evening, right outside the venue where we were reciting poetry, two cars ran into each other because the drivers were both chasing Pokemons and not paying attention, but they ran into each other so slowly that nobody was actually injured. So it just gives you an idea that those simplistic depictions of trolleys and people tied to tracks and so on are very different from real world experiences.
Yeah. I mean, I think, many of those philosophical thought experiments, they have value to them, right? Particularly if they lead people to question or look at something in a different way. There's another classic example, the child drowning scenario, right? And the idea is, here you are going on a walk and you're running late and you're going to be giving a very important lecture. And as you're walking, you walk by a little pond and there's a child drowning, right? And what do? Do you jump into the pond to save that child, knowing that you're going to now get your nice clothes all wet and you'll be late for your lecture? Or do you keep on going to your lecture? Well, clearly you're not going to let a child drown, right? It's only a lecture after all, so you're late. So you jump in and you save the child. And then that thought experiment is then taken to say, well, if you would do such an act to save a child's life, surely you would give $10 a day to feed a child in another part of the world, right? Because really that's also such a small task. It's such a small burden of your life of $10 a day when it can be so meaningful for someone else. So if that's the case, how come not everyone in attendance here, maybe everyone here is giving $10 a day or half of their salary or what they don't need to support or end, world hunger, right? So, these different hypothetical cases are often really helpful at kind of, breaking our frame of thinking and saying, well, why is that and how are things different? But on the other hand, they're also without perspective, right? Because there is a difference to seeing a child in distress in front of you compared to them being distanced, right, in another part of the world, right? And certainly there's a difference between terminating a pregnancy compared to disconnecting yourself from a violinist who lays, beside you on a bed, right? Like it's,
Right.
so it's lacking in, I would say those hypothetical cases, unfortunately, lack in ethics.
Yeah, and sometimes, of course, real life is stranger than any theoretical depiction. When I was in medical school, we had a lecturer who was late for a lecture. And the reason was that he accidentally got locked in a psych ward and had some difficulty convincing people that he should be let out. I mean, it's just, you would say, well, how is that possible? But of course, all sorts of one-off, unlikely things can occur. And yeah. So other questions?
Question.
Yes, I had a question.
Yeah.
I was wondering, I guess, where you see potentially AI being applied to the field of medical ethics. Um, I guess AI is often like used for analytical purposes and trying to understand through data how we can make decisions. And in ethics, you have to make decisions such as making judgments based off of whichever rational or irrational lens you choose. Um, I guess my question is, how does medicine deal with such shortcomings, and how could it be improved through, I guess, the use of AI, or is there even a place for it?
Yeah. So, I mean, the value of ethics for me isn't always necessarily in coming to a decision about how to act. It's also in gaining insight to understanding a situation better, for sometimes realizing questions that, how come we don't ask this question, or how come this question isn't seen? AI is very much a developing field, and there are so many interesting ethical issues around AI that I think at this point there's much that can be learned from taking different ethical lenses to AI to essentially begin to explore some of those different issues. So if, for example, designers of, AI recognize that, coding is actually a way of, and I mean coding for AI, not like codification of ethics, but is a way of actually writing morality into the decisions that we make, often potentially taking away the agency of the individual using particular AI. Then we begin to ask the question of, well, what morality is written into a particular code, right? So for example, if you had a coding system that, tries to recognize, what risk factors are present for people to have a severe outcome from COVID-19, right? Well, if in your coding somehow you operationalize race, right, as a category, and you identify people of a particular race as being higher risk of a severe outcome, in your codification, is race actually dealt with fully as a social construct, or are you reducing it to something whereby you're giving an incomplete picture of what's going on, right? So is, for example, race truly a risk factor for an adverse outcome, or is it the fact that certain racialized groups have a disproportionate risk towards an adverse outcome because of limited access to healthcare, for example? So that's one example, but honestly, AI and ethics, I mean, we could talk for hours about it, depending on what dimensions of AI you're interested in, right? There's ethics around data acquisition, ethics around data storage, ethics around privacy, ethics around ownership of data, how resources are even deployed in the first place, right? So it's a huge field. So I'm not sure if you have a more specific question related to AI and ethics beyond that.
Yes, I was asking this question in relation to decision making. And so a lot of AI that I guess I'm more familiar with is just analytics and being able to come up with a decision based off of the data you analyze. And with a lot of ethical dilemmas, oftentimes you can't ignore the concrete practicality of things, like how much time you have, where you are, like how much money there is. Like there are very concrete variables that you have to take into consideration when making ethical judgments. And so I feel like maybe maybe like the improvement that AI could make to our overall system is to give us some breathing room, like broaden our capacity to make ethical decisions, having a lot of these concretes offloaded to a separate decision-making system. And so they will give you like a breakdown of, given all of these considerations, here's what, this, let's say, and this is a kind of a different topic as well, but viewing AI as also a rational decision maker, another opinion that you could build off of. And this opinion would be, much larger than what a single individual can come up with in the moment, right? You wouldn't be affected by emotions because those aren't inputs for the system. And so you would just have like I guess in my viewpoint, like a more broad range of ethical considerations when you're making decisions.
So, I mean, AI technology for decision making, as I understand it, really ultimately defines on what variables you put into your system, right? And some variables are much easier to put into your system relative to others, right? So to give an example, sex is an easy gender to put in a system, right? Age is an easy variable to put into a system. Lab values are easy variables to put into a system to support decision making. But other variables might be harder to put in, right? Such as willingness for risk, right? Understandings of quality of life, right? Like we struggle with, how do you actually codify or develop a system to measure quality of life, to put into a system that can then look for patterns, right? So that speaks to actually the subjectivity of the AI as much as it speaks to the subjectivity of the researcher, right? So if you imagine a system making decisions, how is it actually conscious, or not conscious, but how does it take in the environment around it in order to make good decisions? And I guess the last comment I give is, unfortunately, although I think AI is fabulous at finding patterns, it can be a struggle for AI to identify meaning, right? And often it's meaning in which people base their decisions. And then the question then becomes, can one have a good decision if one doesn't have a conception of what is meaningful for a particular individual? And so far, I haven't seen AI employed in a way where it supports that. But it's certainly a developing field.
So, one thing that is very surprising in this area is the number of high-profile AI researchers who are thinking about a time when machines are smarter than we are, and killing animals for food is going to be really hard to justify in their view. And a number of them have gone to being vegetarian or vegan, and it's just a real fact. It doesn't mean that they're right or that this really is going to be an important determinant of what happens. And it's affected me. I was already surrounded by students who were largely vegetarian, and 3 years ago, I went that route to the great surprise of my family. So anyway, that's another side of this that you may not have thought about.
Oh, Kim, I've been vegetarian my whole life, so
See?
No, but
You're sort of morally superior to me then.
No, but it's well, when you were speaking of thought experiments on that the website, there's a link to aliens essentially taking over the planet and using humans for consumption, right? And then it essentially turns it around at the end of the video and says if we would struggle with aliens essentially harvesting us for products for nourishment, why is it that we treat animals in that particular way, right? And this is one of the aspects of health ethics that's very challenging, is we're often fairly good at describing what is, but then it's something different to reach that point of saying what ought to be, right? There's always that leap of, I can tell you or begin to explore what is right now. I can describe to you different literature on how parents make decisions for their babies in the context of the NICU. But to say how parents ought to make decisions for their babies, that makes that leap, right, from is to ought.
Yeah.
And that's where it's a struggle. And clearly, if we look into the past, there was decision making that, 50 years ago was okay. It was morally right. But now we look back and we're pulling Dr. Seuss books from the shelves, right? Because there's certain imagery which in them that isn't correct. We're no longer going to show Babar on TV because it, demonstrates colonialism, right? I mean, our society is constantly shifting as far as our moral values. And what is both exciting as well as, I think, a bit nerve-wracking is what will our moral values be in the future? How will they compare? And 20 years from now, how will people judge the actions of those who are acting right now? Right?
Yeah. And there will be one other element, which is there will be actions which no human finds troubling, but the superior intellect of future machines may find troubling. So there'll be a whole part of ethics that is not suggested by humans at all, but it comes from other sources.
It's interesting. There are some ethicists and philosophers who describe ethics as something uniquely human. But on the other hand, it's hard not to look at particularly species that are close to us, chimpanzees, whatever, and not to also appreciate their ethics within those social relationships as well. The question of whether some future smart or intelligent technology will even have a consciousness that in some way apprehends the world in a way similar to ours, so it has its own ethics or even has an ethics that we can relate to, is really unclear, right? Like,
so I'll send this to the class, but you all have 6 minutes you could spend on something. And for the celebration of women and International Women's Day yesterday, Yuval Noah Harari and Natalie Portman talked about, where does patriarchy come from? Oh, great. Yeah, sorry. I may have frozen there. So where does patriarchy come from? When you look at other primates, bonobos, you know, women sort of, female bonobos run everything because they're socially more, you know, adept. And the males are stronger and so on, but that doesn't count for anything. And, you know, in bonobo society. So how does it come about that that in human society, males have been, you know, predominant and had more power and rights and things in so many different aspects? The way you might explain that when translated to other primates just doesn't make any sense. Anyway, you can all watch that for 6 minutes. It's fascinating how little science there is that can explain why it is that male humans have such a, or have had such a privileged status. All the ways you might attempt to explain it don't really make sense when you look animal kingdom wide.
Okay, I recognize we're now past time, so
Yep.
probably.
And we could go on with these things forever. Thank you very much, and we look forward to Thursday.
I will see you then. Have a wonderful next couple of days.
Great.
Thank
Bye.
you.
Bye.